reform, fighting Medicare fraud, helping lower-income children. People can agree on that. But why does a massive program come along at this point? It appears that the president can't explain this program. Congress can't explain this program. We've got 1,000 pages sitting over there. And it looks like it's because the president, who has been popular, and I say has been popular, is getting less popular as it goes on, and the Democratic Congress believes that, or a large portion, that they can push this through under those conditions. Well, that's ebbing away from them as we speak. The people obviously don't agree or understand this program. What is sacred about having this done this year? Why not step back, find consensus and compromise? And readdress an understandable plan that can get bipartisan support. Yes.
Well, I certainly would strive for bipartisan support. All of my career, I have worked on a bipartisan basis. When I was chairman of Fairfax County for 5 years, until earlier this year, most of the major votes I had as chairman on the board on major initiatives were unanimous. I did a redistricting plan on the Board of Supervisors, and redistricting is maybe the most intimate act one politician can commit with another. And I got a unanimous vote. All the Republicans and all the Democrats voted for it. Very unusual. So I've practiced what I preach. I've introduced 15 bills since being your congressman, and I have sought and got Republican co-sponsorship on every one of my bills. Actively gone out and done it. So I believe in that, and I practice that. But we do have a problem that the leadership on the other side of the aisle said in advance, no matter what's in that bill, we're going to vote against it. So it's a little hard to try to find partners to work with if the leadership has said we're not going to play. So we can continue to strive for that. I certainly will. Is there something sacred about getting health care reform done this year? Well, I think people are looking at political momentum. Do we really believe it will be easier next year, in election year, to do health care reform? I don't think so. But talk about, this is not a new subject. Maybe we won't do it. Maybe we'll let this opportunity go and we'll just allow the current system to continue on its course. But if we do, well, for those of you who applaud, I'm sure many of you consider yourself fiscal conservatives. I guarantee you, if we don't address healthcare costs, we're going to find severe restrictions in healthcare provisions over time because we can't afford the trajectory we're on. The motivation here isn't to have big government come in and intrude in our lives, at least not my motivation. My motivation is to try to make the current system better and more effective so that it's there for you and for future generations. That's what motivates me. So whether we do it this year or not, I don't know, to your question, is it magical? No. But I am concerned about momentum, and when do we ever get this done? When is it ever the opportune time? We've been debating healthcare in America and how it's provided since Harry Truman, and the costs as a percentage of our economy have only gone up. I mentioned at the beginning that in 1960, when President Kennedy was president, we spent 5% of our economy on healthcare. We now spend 18% of our economy on healthcare, and if we do nothing, by 2040 it will be almost 40%, by 2050 it will be almost 50%. Not sustainable. Businesses can't afford that, the government can't afford that. And so we've got to do something about trying to rein in the cost of healthcare. And part of what drives the escalating cost in healthcare is how our current system is structured. What gets rewarded? What gets rewarded isn't necessarily outcomes. What gets rewarded is procedures. We reimburse people on a fee-for-service basis, without anyone being maligned about it, but it kind of rewards many tests and many imagings and many procedures, and you may not be getting better. And so there are models, even in America, that work very well. The Mayo Clinic model, the Cleveland Clinic model, they work very well. They have lower healthcare costs, and they kind of have a team approach looking at the whole patient as opposed to this kind of bifurcated, compartmentalized system we sometimes have. So my other point is, the current system is not terrible. It's got lots of wonderful aspects to it. The gentleman over here said, I want to keep what I got, and most of us feel the same way. Can we make it better? Can we guarantee that those choices are augmented and they're there for the next generation too? But honestly, that's what motivates me.